Okay. So I'm gonna go over maternity today really quick. And I'm going over using the Bible for that. But also I'm using the ATI book, this one, the maternity ATI book. I'm just gonna start from like the beginning on how like fertilization occurs. So like, when the stages, pregnancy, well, not stages of pregnancy, stages of delivery, and then afterwards when the baby is assessed and everything. So let me see. Okay, so this is chapter 26, and 26 page, chapter 26 page 762. So fertilization, is the moment conception takes place. It's also called conception, but we don't, for ATI, that we don't even know that for right now. I mean, NCLEX, yeah, but ATI, no. So we want to know that ectopic pregnancy is a serious condition where the egg is fertilized outside the uterine cavity. It can be fertilized, I believe, in the abdomen. Well, yeah. We use Hcg, it's a hormone, which is the reason for ovulation, menstruation, to keys during pregnancy. But okay, so yeah, chorionic villi secrete human Hcg, the hormone that stimulates production of progesterone and estrogen. Okay, let me see. Hold on. Let me look at this really quick. Well, the placenta, it's a barrier that transfers oxygen and nutrients. It also blocks certain substances. The heart starts to pump blood at 5 weeks. So the way I remember it is just your hand. It's the size of your heart, kind of. And if you go like this, you can like think of your heart pumping at 5 weeks. Okay, so on page 765, there is morning sickness. So a common discomfort for maternal mothers. If you have morning sickness, you would want to give them a few dry crackers before raising. And I believe that show up on ATI. So you want to know that you want to make sure that the mom eats dry crackers before rising. I can also drink frequent small meals, low fat meals for sure. Another discomfort they may have would be urinary frequency, and you can tell them that they can perform urinary frequency, they can lie on their side, to decrease pressure on the bladder. So they can lie on their side. You want to know that at week 10, the movements start to begin, the first fetal movements. So week 10, if you think about it, 10 weeks, you do your hands like this for 10 weeks and there's movement. Hold on. At 11 weeks, the pancreas, they release insulin, and the kidneys produce urine. So the way I think about it is 11 weeks. So if you go like this with your 2 fingers for 11 weeks, you're secreting urine and insulin. I don't know, because when your urine drains out, I don't know. That's just the way I remember that. So you want to if they have sleepiness or anxious of pregnancy, you want to make sure you can like tell them if they can take a warm shower. On page 766. What you gotta know is that week 27 on page 768. a substance called surfactant begins to form in the lungs, preparing them for independently after birth. So it's important that, you know, they have adequate amount of surfactant. You want to let them know that they can flex or exercise, walking, to prevent like muscle cramps. You drink lots of fluid. Okay, so now on page 771, there's this amniotic fluid, right? And it acts as a cushion to prevent for the fetus from any injury. And the fluid is clear and slightly alkaline. There is this one test, I believe it's called the nitrase. I don't know if I'm saying that right. But there is this test that they can test the woman if she were to come in the emergency unit, I don't know, you know, into the doctor's office, stating that she's leaking fluid. So they would, you know, take that sample, the little fluid, put it on the paper. I don't think it's called nitrates, but they put it on the paper. And if it turns blue, then they're positive for amniotic fluid. And positive for amniotic fluid. Now, you want to know that the fetal heart tones, you can auscultate them around 10-12 weeks above the symphysis pubis. And you have to do it for a full minute. The fundal height at 18 to 30 weeks, the fundus is the same number as the weeks of gestation. So 18 to 30, because I believe that does show up on ATI somehow, like on either the options, or sometimes they'll give you like one of those like questions where you have to click on little boxes, and you want to make sure that you know the weeks of gestation, 18 to 30 weeks, that they equal the fundus in centimeters. And like we said, you know, if you're going to assess for the fundus, you do it just above the symphysis pubis. So an ultrasound, when women go and get their ultrasound done, you want to make sure that let them know that they have to drink water. There's a test you got to know. It's the quadruple marker screening, and that's a screening for any defects. If you guys remember, if the levels of a fetal protein, if they're down, then that's indicative of like Down syndrome, but if they're up, then that indicates neurotube defects. So very important for you guys to know that. Nuchal transparency testing. It's also important to know because that assesses for any Down syndrome characteristics. So they measure the like the neck folds, and normal findings would be up to 2 millimeters, but if they find anything that's greater than 2 millimeters, then that can indicate Down syndrome. We also do the chronic villi sampling, and that one's done between 10 to 13 weeks to assess for, it requires aspiration of the tissue in the placenta, and you know, it can be done vaginally or abdominally, but the risk for this would be just, you know, infection and miscarriage. So this is kind of like I would say it's not a safe procedure. Well, if you're at high risk pregnancy. Amyocentesis, that's removal of some fluids. So let me show you guys what right here. And basically you want to make sure you have your bladder empty because you don't want to like puncture that bladder. And this is done, I believe it's done around 14 weeks. And, you know, you can use it to assess for any like defects or chromosomal abnormalities. Non-stress test, you definitely have to know the non-stress test. You have to know on ATI, it always, or non-stress test is to detect for any fetal movements. And you have to know, you can't confuse this with the other contraction test because, so let me talk about the non-stress test. The non-stress test, the mom, they push a button whenever she feels a movement, right? And that's good because you want to have movements. If it's reactive, it's normal. If it's greater than 15 beats per minute for 15 seconds or more, then that's fine. But if it's not reactive and the fetal heart rate does not accelerate, then that's not normal. So it would be non-reactive. So the non-stress test, let's see, think about like when you're having stress, you're anxious, you're moving, and you can associate non-stress tests with like movement. And results, you know, you want a reactive, which is normal movement. And you don't want a non-reactive movement because that can indicate, you know, other things like, you know, maybe the fetal might have, let's say, died, passed away in there. But make sure you know non-stress test. That does show up on ATI. You want to know the contraction stress test as well. Contraction stress test is when they induce contractions using either nipple stimulation or oxytocin. And you want a negative result, which is normal, because then you know that there's no late D cells in the fetal heart rate. You want a negative because you want to make sure that the fetal heart rate occurs with the contractions. No, there is no change in fetal heart rate with contractions, because when the woman later on in pregnancy is going to give birth, you know, and they're going to have the contractions going on, you don't want the fetal heart rate to keep on dropping. So if we know now whether or not like we stimulate contractions via oxytocin or nipple stimulation, and if we know that there's no fetal drop, then we're fine. So that is normal. So we want a negative contraction stress test. A positive would indicate that the fetal heart rate is dropping, and we don't want that, because if it is dropping now when we're stimulating contraction, then, you know, what's going to happen when the woman goes into labor and her body is, you know, stimulating those contractions. So then, you know, the baby's going to be at risk there. Let me see. I wanted to let you guys know about just in general physiological changes during pregnancy. You're going to have increased respiration rate. Cardiovascular is going to your cardiovascular is going to increase. For pregnancy women, the hematocrit and hemoglobin, they're a little lower than normal, which is fine. So I believe that does show up on ATI sometimes. Like the hemoglobin would be a little low, but that's fine. You know, they're gonna have that lumbar type of like back, because their weight is being diverted forward. So now their back is going to be like curved inward, making that lumbar shape. So you always want to let them know to, if they're going to rest, always sideline. That does show up on ATI. Want to make sure that they're sideline. because you don't want them to put any pressure on, let me see the proper name for it. It's like the, you want them to put any pressure on a aorta and vena cava, because then that can cause supine hypotension syndrome. And, you know, that can cause the woman to experience any like syncope, aka dizziness. So you want to make sure that they're sidelined. So expected changes, you know, the integumentary, they're gonna have the closama, the brown little patches here in the face, the striae gravidarum, which is like the stretch marks, which is not perfectly. It's fine. It's normal to have that. And then they're gonna have the black little line that's like, you know, from the navel to the pubic bone. So that's called Leon nigra. Am I saying that right? So please make sure you know that. You want to make sure you know that the breasts, that they, you know, in the second trimester, they produce that colostrum. Colostrum. There's so many words I can't pronounce. And it's like low in fat but very high in protein. And yeah. Make sure you guys know Nigel's rule, -3 + 7. But those, I believe, sometimes show up on ATI. And those show up on ATI, so make sure you guys know that it's -3 months plus 5, I mean, sorry, -3 months plus 7 days. So, or -3 months plus 1 week, which is 7 days. -3 + 7. So make sure you know that. Sometimes they can give you like a date and you're gonna have to subtract whatever date it is. So make sure you know -3 + 7. For maternal nutrition, it's very important that you guys give them folic acid, increase their protein, folic acid to prevent neural tube defects, right? Protein, iron, even they can also take you know, ferrous sulfate, aka iron, with vitamin C to increase absorption if they have low RBCs, to supply oxygen to the baby. Increase calcium, vitamin D, and fluids. If the mother has PKU, which is fetal PKU phenylketonuria, they have to follow a strict low protein diet, so no chicken, right? Throughout their pregnancy. That does show up on ATI. So PKU, you can think of PKU as P, so P for protein, not protein. Oh, you have to know maternal weight gain. So normal weight gain for an average woman would be 25 to 35. So you have to know it's 25, 35. If you're underweight, think about it like this. If you're underweight, you're going to gain like about 28 to 40 pounds. But if you're normal, then it's 25, 35. But if you're a little above, you know, your weight, then you gain less. So I believe like the skinnier you are, the more weight you gain. And, you know, the more weight you have, then the less you're going to gain weight. You want to make sure that, you know, during pregnancy you avoid caffeine. So like drinks that I drink, definitely don't want to be drinking that. It's really bad. No hot tubs, no saunas, no smoking, like we said before. Like you just want to be a healthy individual. No mercury. And you always let the provider know if you have any severe abdominal cramp, any type of vaginal bleeding. So whether it might be like small or an abundant amount, chills, you know, vomiting, severe vomiting. Like if you have severe hyperemesis gravidarum, then you want to make sure you let the provider know, because that can cause like dehydration, a decrease in electrolytes, and that's not cool, because especially your potassium, if it starts decreasing, then you can get cardiac arrhythmias, and you don't want that. So for women, like we mentioned before, they have unpleasant side effects. So they might have like constipation, and you can tell them to increase their fluids, their fibers. If they have fatigue, you can take naps, but make sure they're like sideline. That way they don't put pressure on that vena cava and lower down their blood pressure. So heartburn, small frequent meals, no spicy or greasy food, because that can stimulate the heartburn. And then, like we said before, the alpha fetoprotein, that one, if it's down, it's Down syndrome, and if it's up, it's neural tube defects. So you want to know that does show up on ATI. So make sure you know that. Hemorrhoids, sitz bath, that does show up on ATI. If somebody has hemorrhoids, you want to do warm sitz baths. And somebody that has nausea and vomiting, that does show up. This does show up on ATI. Small frequent meals, but like crackers upon getting out of bed in the morning. If they have urinary frequency, they're constantly going and having urinary frequency, Kegel exercises. It'll help with to decrease their urinary frequency, so their stress incontinence. So in general, sometimes on ATI, I know this is like maternity, but like for med surg, they'll state like somebody, coughs, and when they cough, they secrete urine, and that's one of like the that type of like incontinence is stress incontinence, where the weight that you're carrying or like the cough that stimulates urine to come out. So urinary frequency. So in pregnant women, stress incontinence is not abnormal. It's like I'm pretty sure there's women that have that. So I don't want to say everyone has it, because I don't know. I've never been pregnant. So, but make sure you do Kegel exercises, please. Varicose veins, just ambulate, right? Ambulate, wear compression socks, but just want to walk. Like we mentioned before, ultrasound, so full bladder, right? Full bladder, chronic villi sampling, that's performed, 10, 13 weeks. Contraception, this does show up on ATI, the diaphragm. You want to know a diaphragm because this does show up on ATI. It can be inserted 6 hours prior to having sex, or what's it called? And I can stay 6 hours after. So 6 and 6. That's how I think about it. 6 hours prior to having sex, and then 6 hours after having sex. But you also need to know it has to be refitted every 2 years. So I don't know how diaphragm looks like, but make sure you know that 6 hours before, 6 hours after, and every 2 years. You have to know that. That does show up on ATI. You have to know the signs of pregnancies, signs of pregnancy. You have to know that. You have to know the presumptive, the probable, and the positive signs of pregnancy. So the presumptive signs of pregnancy, what I've seen would be like nausea, vomiting, amenorrhea, like where you don't have your period. It could be quickening. That can also happen. Breast changes, that can also happen. And just fatigue, but it's very, I believe the term is like very subjective. So only the person can like feel it, like I can't tell whether you're experiencing nausea because you're the one experiencing it. So that's subjective. So that would be presumptive. Probable is more of like, okay, maybe you might be pregnant, so make sure you know Chadwick sign, Hagar sign, and Goodwill sign. Those 3 you have to know. And you have to know for for NCLEX, you do have to know the definition for Chadwick's, Goodwill's, and Hagar's, but I haven't seen it, or I have, I think, it's been a while, the exact definition, but I know for sure I was watching this one video on YouTube and they said that you have to know, you have to know the definition for Chadwick, Goodwill's, and Hagar's, because they do sound like, I have a paper. If you guys have them, if you guys wrote it down, then please make sure you guys know the differences between Chadwick's, because there is a slight difference. I mean, not slight, but there is a difference in them. Let me see if I can find it here. Okay, so Hagar signs is a softening of a softening of this segment is called that did not give me. Okay, this change in softening or increases, you know what, forget it. I don't like this definition on here, but definitely, at least for ATI, make sure you guys know Chadwick's, Hagar's, and Goodwill's. So the way I think about it is, well, I mean, the first one, Chadwick's, I mean, I don't know, just a person. Think about a person. Goodwill's like, what's that one store called? Goodwill? Is that Goodwill? Or it's like a thrift shop. I don't know. It just reminds me of a thrift shop. Goodwill. Goodell's. And then Hagar reminds me of Hector. I don't know how. But so Chadwick's, Goodell's, and Hagar. So make sure you know that. And bottlement too. Bottlement is where the provider goes in there and they kind of like palpate inside of the uterus to see if they feel any like rebound in there. So that's that. Oh, and you also want to make sure, for sure. So positive signs. Positive signs is something you can see, you can see it on the ultrasound, you can see it on the fetal heart rate, the tones where you assess for that. So there is actual movement, there is a fetus, and everything. Oh, one more thing. The probable signs, another one that can be included in there is a positive pregnancy test. Because when you take the pregnancy test, it's like, okay, what do you do? Like if somebody that's pregnant, not pregnant, but they take a pregnancy test and the little line comes, on there. I don't know if it's negative or positive, like I've never been pregnant, so I don't know. But whatever sign comes on there, and let's say it's positive for pregnancy, I believe. Then it's probable, right? I mean, it came out positive, it's probable, but but what I've seen on like TVs and movies and stuff, they always go to the doctor to confirm it, right? So to make sure that it is a positive result. So that's how I think about it. So Nigel's rule, like we said, -3 + 7. Please know that. Okay, you guys can't forget about that. Like that's very, very important. Oral contraceptives. This does show up on ATI, so you have to know your oral contraceptives. You have to know that oral contraceptives are contraindicated if you smoke, right? Smoke. And if you have uncontrolled hypertension, you have to know that. And if you have a history of blood clots or stroke or just in general coronary artery disease. So in general, think about it like this. So oral contraceptives are, contraindicated for patients that smoke, but anybody that has just any type of like cardiovascular problem. So what do we think about when we think about cardiovascular? Your heart, so hypertension, coronary artery disease, stroke, that has to do, that can do with your heart, cardiovascular. So any cardiovascular disease that you have, that's like a big no-no for oral contraceptives. Now you have to monitor for DVTs. It does not offer any STI protection, but you have to monitor for DVTs. I believe that somehow, I think that I've seen it on ATI, but I don't know how it's stated on there, but you have to know that you monitor for DVTs. And progesterone only pills are safe during pregnancy. So make sure you know that, please. IUDs does show up on ATI sometimes. You want to make sure you just check for the strength length, right? If you have an IUD, you check for the strength length. For any, report any odor to the provider. And it does, you have to know that IUDs do increase the risk for ectopic pregnancy. You have to know that. It does show up on ATI. So make sure you guys know that. So now we go into helper motion. It's very important that the woman gets frequent visits to the dentist, because if, let's say, they're washing your teeth and they accidentally cut something, right, and they introduce bacteria, that bacteria can travel into your system, and worst case scenario, you know, you introduce some type of like you know, bacteria in there, and you know, it can cause more problems. So make sure you go to the dentist, right? Get those teeth work done. So, no drugs, no marijuana, please. I'm just reading what states here. Okay. You want to count the fetal heart tones. You want to make sure they're experiencing at least 10 to 12 movements per 1 to 2 hour period. Just make sure you know pica refers to lack of iron and zinc in the body, because then they start like craving like cardboard or ice chips. I don't know. I know ice chips, I've seen people, women, crave them when they have a decrease in iron. So yeah. Now what you have to report to the provider would be this you have to know. This will show up on ATI. Sorry. A lot of things show up on ATI, but this does show up on ATI. You have to report any signs of diplopia, aka double vision, any visual disturbances. So diplopia, vision disturbances, continuous headache, numbness, you know, the or swelling of the face and fingers, any abnormal vaginal bleeding, any drainage, any persistent vomiting that's like continuous for like 10 days or so. That's worst case scenario, but just, you know, epigastric pain that does show up on ATI, epigastric pain. Any like rapid weight gain that's below what, you know, the normal range. But the persistent vomiting, epigastric pain, continuous headaches, the facial swelling, you have to report that to the HCP, because I believe that could indicate that can be signs and symptoms of pre-eclampsia. So you want to make sure that you get that assessed. You know, for a lady that's vomiting severely, has that hyperemesis gravidarum, you want to make sure that they're drinking, you know, fluids, because this vomiting, severe vomiting, can lead to dehydration, that can lead to kidney stones in the urine. So we don't want that. So we want to make sure, you know, fluids, or what do you call it? Yeah, fluids. Heartburn, make sure you do small frequent meals, like we said before. We talked about the skin changes, the linea nigra, clausoma, striated gravidarum, stretch marks, spider nevi, those are normal. Hirsutism, those are normal. Hirsutism is hair growth, so it's fine. So make sure you know left line position. You want to make sure you recommend that for sleep and rest, to prevent that supine hypotension syndrome. You want to make sure that they, you know, that anxiety is normal. You're going to go through changes. Leukorrhea, this will show up on ATI for women, which is like a white vaginal mucus, an increase in vaginal mucus. But leukorrhea is normal, unless there's an odor to it. But it is normal from the hormonal changes. So leukorrhea, right? Don't forget that. That does show up sometimes on ATI, but that's completely normal. So it's cool. Like, not gotta worry about that. Make sure if the woman is traveling, make sure they walk, they ambulate. If they're traveling like on a plane, sitting for long periods of time, make sure they ambulate. So now chapter 27, page 797. You want to know, okay, now page 798. Okay, so for this, make sure you know the lightning, right? 2 weeks before the fetus drops, and then notice the lady will notice like a decrease in their weight, but make sure that they're settling, that they drop. That's what lightning is. Sorry for my chickens in the background, but you have to know, true and false labor. You have to know that. So you have to know that, in true labor, you have regular contractions. They are stronger and closer together. No, it doesn't stop. It doesn't go away. It just continues and continues and continues. And make sure you know that any walking does increase the intensity. And, you have to use contractions continue despite comfort measures, and you get the effacement and the dilation, and the presenting part of the fetus is engaged in bolus. So there's also another one that does show up on ATI that I've seen is you get that contraction from the lower back and it travels to the lower abdomen. So the way I think about it is like, if you're tying like a rope around your waist, when you grab the rope, you put it from behind you, you bring it from behind you, and then you bring it out in the front. So you're tying like a rope. I don't know, that's the thing. But you're gonna have like lower back pain traveling to start in lower back and then travel to the lower abdomen. Kind of makes sense. But yeah. You're gonna get the effacement, dilation. I haven't seen this one, okay, but you want to make sure you know this is important. I like this one. The stages of labor, page 69 on your on ATI. So you have to make sure you know this. The first stage, second stage, third, and fourth. The first stage is very important. You have your latent, active, and transition. The way I think about it is late, L-A-T, but there's no E. So late. So Latin, active, and transition. You have to know that during the first stage, which you're late, you're Latin. So you have the onset of labor. You want to make sure that some dilation and effacement is going on, but that it hasn't reached like full effacement. You have to know the active one, which is rapid dilation. You have kind of like a feeling of helplessness. You have anxiety, increases the contractions, get a little stronger. Transition, this is where like they're tired, they feel like they can't anymore, and they feel like an urge to push, but make sure they don't push. They can't push right now. because they're not fully either fully effaced or fully what's the other word called, dilated. So you do get sometimes like bowel movements and a bloody show. But this is the most difficult part of labor. So LAT, late. You want to make sure that they're in a second, third, fourth stage. So second stage, that's when they can push. That's when, like, okay, you know, that's where they give birth. Third stage is the placenta and the baby. You assess for those. If it's pointing toward, you know, when the this does show up on ATI, sometimes it'll ask just like, you know, what side is the dirty and which side is the shiny. So the dirty is the one facing mom and the shiny is the one facing baby. So because the dirty is like the mom just gave birth, so she's kind of like not clean. So that's how I think about dirty, Duncan. And then the shiny, the other one would be the baby is cute, the baby is nice looking, so shiny part. Fourth stage would be you just assess for maternal and fetal vital signs. So make sure you know that. Okay. Very important that you guys know VO chop, because when, you know, we're assessing for fetal heart tones, VO chop, you know, VO, V for cord compression, E for head compression, A is okay accelerations, and late for placenta insufficiency. So you want to make sure you know your VO chop and what to do. So for variable cord compression, you want to make sure that they are in placing the knee to chest, either and notify the provider. So place patient knee to chest or position them on their side. All that late D cells, that's very that's placenta insufficiency. So you want to make sure that the patient is left, you know, left lying. You can give them IV fluids and oxygen and notify the provider. So very important to know just VO chop in general, just what causes it. The majority of the time you would have to like put the mother in a left sideline position, so you don't put any compression on the cord or the head or the you want to make sure you know prolapse umbilical cord. So this is where prolapse umbilical cord, so this is where the umbilical protrudes through the cervix, and you have to call, it's a medical emergency, like you have to call for help. And the first thing you want to do is you want to grab your apply 2 sterile gloves and put 1 on each side of the cord. Well, you have to insert 2 fingers in the vagina, and then you have to elevate the let me see, 2 fingers into the vagina, 1 on each side of the cord, and elevate the fetal presenting part off the cord. So just make sure you put 2 in there. Do that. And you want to position the mom in a knee to chest or a talon squirt. But on ATI, I see them more as like a knee to chest position that you want to put the mother in. So make sure you guys know that. For pain management during labor, so always assess for, if you're going to give them an epidural, always assess for that hypotension. It does, I believe it does show up on ATI sometimes. Epidural block, when you give them, you want to make sure that you assess for that hypotension, because it can drop the maternal blood pressure, and it can drop the fetal heart rate. And if you're going to give a spinal block, you want to make sure you assess the same thing for decrease in blood pressure and decrease in heart rate. For stages of labor, we mentioned before, the ATI book is better to look at. That way you know the first stage, the LATE, the second stage, third and fourth stage. So make sure you know that. Make sure you know the lab values for like for babies. I'm not calling them babies. There's a term for them. What is it? Fetal? Not fetal. For the, when they come out for the baby. I'm just gonna say for the baby. Respirations 30 to 60. Heart rate is 110 to 160. And temperature, I just think about it like 97 to like 99, I believe, the temperature. Their blood pressure is going to be a little low compared to like us adults. So the systolic would be at like fetal blood pressure would be 60 to 80 systolic and 40 to 50 diastolic. Just the way I think about it is systolic over diastolic. So 60 to 80, I think of like people that they're gonna have that Medi-Cal. I mean, Medi-Cal, I think they do. Medicare they get, I believe, at 65, around there, you know. But I think of it as like 60 years old, they get Medicare till 80 when they pass away. But I know people live longer than 80, so I'm just saying. But and then diastolic, I think about it like just like 40 to 50 people, like older people. I mean, no offense to anyone, sorry. I mean, that's just the way I put it, like in my head, like 40, 50. You know, people are celebrating the 40th like anniversary or 50th like landmark, you know, 40, 50. And then when you get the Medicaid, then you're around like 60 to 80 years old. That's how I think about it, systolic over diastolic. But in general, their blood pressure is going to be low versus, you know, compared to like adults and children, like adolescents. So you want to know the okay, you want to know the okay, you want to know the uterine rupture. Uterine rupture is tearing. It's a very, very sharp abdominal pain. And you know, you can have like hemorrhages. So I believe for this one, just make sure it's a very sharp abdominal pain, uterine rupture. So this is when like the uterine from the wall like ruptures. It's like a band-aid, you know, it like tears and it's going to be painful, right? Sharp, painful. And so you're going to have to perform a possible C-section for those patients. A VAD, vacuum assisted delivery device, that's used to, it's like a little cup that's used to suction, that's attached to the fetal head, and it's used to like suction them out to help it, you know, suction them out. The only complication with that would be cephalohematoma. Cephalohematoma is it's like I don't know how to explain it, but I'll explain it right now in a bit. Oh, hold on. Sorry. Okay. Oxytocin is used, right, to stimulate frequency and uterine contraction during labor. So it's very important to know what oxytocin is. We have your Bishop score. You want to make sure that it's high enough so that they can prepare you for labor induction. Cesarean C-section, used for patients where the fetus is very big, or where they have fetus that's in the breech position. Premature rupture of membrane. So like we mentioned before earlier, you do the pH test of the vaginal fluid, or whatever, you know, the fluid that comes out. The nitrazine, that's what it was called. The paper, if it turns blue, it's positive for amniotic fluid. So blue, you know, if it's blue, it reminds me of a baby, especially if it's a boy. I don't know. That's the way I think about it. amniotic fluid embolism. So when amniotic fluid embolism is like when fluid infiltrates like the maternal circulation. And so the signs and symptoms that they might have is just think about this like an embolism, right? If it's a pulmonary embolism, you have tachycardia, dyspnea, chest pain. So you want to make sure that you administer the patient oxygen, or you assist with like CPR or any intubation that may be needed. So amniotic fluid embolism, think of like pulmonary embolism, tachypnea, dyspnea, chest pain. So there is that. Here is a picture. I was using my flashcards, but here's a picture of that I was talking about earlier during true labor, dilation, and effacement. Right. See how it's opening? Okay. You want to use non-pharmacological pressure. So one that you got to know is the sacral counter pressure. I've seen that on ATI where you put the where they ask, I believe, I forgot how it's worded, but they state, you know, that's a non-pharmacological measure where you put the heel of your hand or your fist pushed against the sacrum to relieve lower back pain, or they can use breathing techniques, you know. But I've seen the sacral counter pressure on ATI. Pain management. So with pain management, we can give them the opioids, benzos, antiemetics, but you have to make sure you assess. If you're giving an opioid, please make sure you assess for decreased respiration, blood pressure. All vitals are going to be low. Opioids for everything. If you give an opioid, make sure you know the antidote for opioid, naloxone, and pudendal nerve block. So this is when they have to do an episiotomy. So let's say the fetus is way too big, right? And it doesn't come out to the vagina. So the provider, they're going to like, I believe it's like numbing it, nerve, so they can do the cut the vagina, make the line, and take the baby out like that. So it's the pudendal nerve block. Labor dystocia, it's a prolonged, difficult labor, especially when the infant, when the fetal is very big. So it's just long labor. You have to know the ischemia. I'll show you guys right now in a bit. I'll show you guys what I'm talking about later. I'm sorry, I'm just trying to get through this. That way I can give you guys what you guys need to know, at least for nursing, for maternal that I've seen on ATI. You have to know that the burst of energy, the lightning when the baby drops to the pelvis, that's important to know. That's changes, that's psychologic changes for labor, physiological changes. So they're gonna have bloody show, which is brown, bloody vaginal discharge, burst of energy, which is nesting, and the lightning. You have to know that one that it drops, and you have to know that you're gonna have a weight loss of 1 to 3 pounds when the baby drops into the pelvis. So you have to know that for sure. You have to know. Okay, I'm diving right now into chapter veal chop. Please make sure you know veal chop. So the APSCAR score, I haven't seen on ATI as much, but if you guys know how to do it, you guys can do it. Go over that, but just because it's ATI, I haven't seen it on ATI. Maybe once or twice. Or for a test, like practice A, practice B test, I haven't seen it on there or as much. But it is important still to know for NCLEX, at least. So please make sure you guys know that the father always ask, if he's fine, because they sometimes may be a little jealous that, they have all the attention is being diverted to the baby now. And yeah, oh, this is what I was talking about, the pudendal nerve thing. Oh. Yes, right here. That's where they go in a minute. for the episiotomy. So oxytocin, this for stimulation. Okay, chapter 28. You have to know that immediately after delivery, the uterus is midway between the umbilicus and the symphysis pubis. You have to know that. During the first 12 hours after birth, it rises above the umbilicus at the midline, and then 24 to 48 hours, it starts descending 1 finger breadth per day. And by the time it's like 6 to 8 weeks, it's barely palpable. So you have to know that one. That one, make sure you know that, right? That does show up on ATI. You have to know, okay, you have to know that, let's see. Oh, the 3rd and 4th degree burn, the 3rd and 4th degree laceration, you'd never give a patient a, I believe you never give suppositories or enemas, 3rd or 4th degree. Know that by heart. You can't. 3rd or 4th degree. I saw on ATI, I believe I saw on the COM too. 3rd and 4th, you don't give them any enemas or any suppository. Because if you think about it, 3rd and 4th, like, the laceration is very like delicate, and you don't want to be doing anything to it. Like, you just want to make sure that it's don't mess with it, you want to let it heal. Okay, let's see, breasts, they get enlarged, they start producing colostrum, which is a milk that is watery and slightly yellow. You want to make sure that it's normal for the woman to be sweating, they have diaphoresis. It's normal to do that after birth, and it's normal for them to have those that shakiness, like the jitteriness, like the shakiness. That's normal to have. But you want to make sure that they are ambulating when they can. You want to make sure that if the bladder becomes distended, that's why you want to make sure that they're going to the bathroom, because if the bladder becomes distended, then they can push the uterus up to the side, and that prevents the uterus from like contracting. So we want to make sure that if the bladder is distended, or if the uterus is like deviated to the right, to the left, you want to make sure you have them ambulate so that they can get those clots out. You want to make sure that if they are, what else do you need to know that I've seen? You have to know it's normal for them to have the Leon Negra, the ones that we were talking about earlier. It's normal for them to have, let's see what else. So I see. There's a lot of body changes that happen, like their feet grows. Okay. So medications after delivery, you want to make sure that, okay, so medications, oh, this coffee is making me. Okay. So medications after delivery, you want to make sure that, you can give them the erythromycin ointment. This prevents exposure. Well, it's caused by gonorrhea, chlamydia exposure in the birth canal. So if you have this, it prevents the gonorrhea or chlamydia that can be present in the birth canal. You can give them vitamin K to prevent hemorrhage, and this is given IM. Vitamin K, and hepatitis B is given IM, nevastus lateralis, and you need an informed consent for hepatitis B. So make sure you know that. On ATI though, I believe it's the vitamin K, it's stated differently. It's a different word that they use. It's not vitamin K, and it's on the ATI book. If you guys go under the medications that you give them, like right after delivery, the erythromycin ointment, the vitamin K, and the hepatitis B, there is a different term that they call it. They don't call it vitamin K, they call it a different word. I believe it starts with a P, but make sure you know that. The Loshi assessment for the mom, you want to make sure that you need to know that you can't have any heavy pad within 1 hour, and you can't have a heavy saturated pad within less than 15 minutes. That is dangerous. That is like hemorrhage right there. So no, a heavy saturated pad that is less than 15 minutes is emergency. You cannot have that. You have to let the provider know. That's what I've seen on ATI, either that or the heavy pad within 1 hour. Those, you have to report. You definitely want to know the lotia rubra, lotia serosa, lotia alba, but for ATI that I've seen is the heavy saturated one pad less than 15 minutes. That is excessive bleeding, and you always want to make sure you assess for the buttocks, for any lacerations. You want to turn them around, for anything. You want to always be assessing underneath for any lacerations. Fundal assessment, like we said, you want to make sure you empty the bladder. You do want to perform a soft massage until you get that uterus firm to expel the clots. Very, very important. So make sure you do that. Or oxytocin, because it stimulates the contraction. So you can also do that to stimulate contractions and reduce the bleeding. Fundal assessment, like we mentioned before, 12 hours after delivery, the fundus should be firm, midline, and at the level of the belgus, and then it should be descending 1 centimeter each day. After 2 weeks, 2 to 6 weeks, I believe, it shouldn't be palpable. It should be just down here. So breast engorgement is when your breasts, so breast engorgement. So you want to empty breast completely with each feeding. You want to apply like warm compressions prior to feeding, or you can also take a warm shower. And then to do that, if you're going to be suppressing lactation, then you want to wear a supportive bra, or something that puts pressure on the boobs, on the breasts. Sorry, I have to use proper medical terminology. On the breast, or you can put cabbage, but anything that's cold. If you're going to do suppression of lactation, you don't want to take a warm shower, right? If you're trying to suppress that, you want to make sure that you wash your hands prior to feeding. During feeding, you always want to make sure that you're constantly burping the baby. You're burping, burp, burp, burp. And it's normal to have cramps during breastfeeding. And just make sure, you do that. You want to make sure postpartum immunization. So you want to make sure you take that rubella, but the rubella vaccine, you want to avoid being pregnant for at least 28 days after immunization. So 28 days after immunization, you want to just avoid being pregnant. Rogaman, given 72 hours of birth to Rh negative moms who gave birth to Rh positive babies to prevent antibody formation that could affect subsequent pregnancies. In simplest terms, just Rogaman, very, very important to give to the mom, because sometimes the mom can be negative, the baby can be positive, and during the first pregnancy, I remember teacher stated that the first pregnancy, if they didn't get the Rogaman, it's not, I don't want to say it's fine, but it's like saying you got away with it, there's no harm to the baby. I believe it's the antibodies are not going to attack the baby. But now that the body got pregnant and understands okay, somebody that is Rh positive, they have that again in their system, then I believe it's like the body attacks the baby somehow. So that's why very important to have it like as soon as like you can. Whether you're on, I believe, on your first pregnancy, very, very important to have. So sure you know that. I hope I stated that correctly, but make sure you do the roll. Maternal role. So after pregnancy, right? After when the mom gives birth, oh, sorry. Heart is racing. So you're taking in, right? Your mom, you're taking in. It's like this. Like I don't have like. I want to show it to you guys. It's like. I'm sorry, my heart is racing. So you're taking this in, right? You're taking it in like, oh my gosh, you know, it's like a little baby, like you're here, like, you know, I'm with my friends and like I'm telling them like I'm taking it in, like, oh yes, you know, my birth was so it was painless, which I'm pretty sure it wasn't, but like, you know, they just talk about it. They're like, yeah, you know, my husband, he was like laughing. He was, I don't know, he was talking and blah, blah, blah. Nurse did this, doctor did this, and all that stuff. Okay, so now you're taking it in. Now you are taking hold. So you're taking it in, you're taking hold. And when you're taking hold, you want to know, okay, what do I do to have my baby be safe? What do I do to make sure he is consuming the right amount of like the right formula, the right drinking the amount of milk that he's supposed to, how do I change him, how do I you know, do anything. You care about more of like how to take care for yourself and the baby. And then letting go is more of like, okay, letting go, like, yeah, like you can take care of my kid, I'm gonna go back to work. So you're taking in, taking hold, and letting go. That's how I think about it. I'm sure you know that, please. The crib does show up on ATI. Just back to sleep. The pacifier is fine. You want to make sure that the baby is away from hot vents, and you want to make sure that they're on a firm mattress, and the crib slates are about 2.5 centimeters apart, around there. No blankets, no toys in the cribs. Back to sleep. Head. So this is what I was talking about earlier. When you do that BAP, the little vacuum thing, if they're having a hard time, provider's having a hard time taking the baby out, you can use the VAP, but now this causes cephalohematoma, which is a collection of blood in between the skull and the periosteum. So it can last for several months, and it's very just like, it doesn't cross the suture line, so it's like a full collection of blood, you know. It's very I would say that's not normal to have, you know, like very caput suicidium, it does cross the suture line. This is for the head, you know, like, okay, sorry. Always have the babies during formula feeding, always have the baby in a semi-upright position. Keep burping them, right, throughout. They should have about, I believe it's 6 to 8 wet diapers. Bathing, you want to make sure that you do not immerse the baby in like a bathtub unless the cord has come off. Cord comes off like about 10 to 14 days. Fold the diaper under the cord, and you have to report any like drainage that's coming out from the cord. Like if it's like prudent drainage, you have to report that. You always clean from the cleanest to the dirtiest. So make sure you know that. Expected findings from the baby. It is normal for the baby to appear pink and acrinotic. Acrinotic is like when their skin is kind of bluish, but that's normal. That is very normal. Vertex, that is that thick of substance, the white, the protects the fetus in the ureter. The lango, which is the hairs, on the skin, that is completely normal. That does also show up for patients that have anorexia, where their body is trying to keep them warm. Because you have anorexia, you're going to be cold, your vitals, all drop, and you're going to be cold. So your body is trying to keep you warm, and by doing that, it brings out the lango, the hairs. Abnormal finding is jaundice within the first day. Abnormal. You have to report that, because they would have to do, they would have to get phototherapy for that. Circumcision, you have to know circumcision. You have to know the plasty belt and the Gomco/Mogen clamp. You have to know that. Back. But circumcision, you want to know, you want to use the you want to know, you have to know this. You have to know this does show up on ATI. I know a lot of things show up on ATI, but this does show up on ATI. You have to know the Gomco and Mogen, or the and the plastic belt technique. So circumcision, it's contraindicated for babies that have hypospadimus and epispadimus. So hypospadimus. So this is our wee, and if you think about it, like hypo underneath. So this is when they have like a little hole down here. They have a little hole in their pee down here, and epispadimus is when they have it up here, little pee. I mean, they have a little hole in their pee up here. So hypo and epi. So if a baby comes out with that, right, either hypo or epispadimus, it wouldn't be safe to do a circumcision. I just think that's kind of like common sense in a way. Like, why would you perform a circumcision on somebody, regardless if you knew anything about kids or anything? Like, I just wouldn't think it's safe. I just think it wouldn't be safe. I don't know. I mean, I think it's common sense. But anyways, what you have to know is that the Gomco and the Mogen clamp, they don't require any petroleum jelly. I mean, they do require petroleum jelly. Oh my gosh, I don't want to get you guys confused. They do require petroleum jelly. The one that doesn't is the plastic belt technique. And the way I remember is plastic belt technique starts with P. So, and petroleum jelly. So PP, petroleum jelly, plastic belt. It has the petroleum jelly. So why would you want to put petroleum jelly? The one that the Gomco and the Mogen that doesn't have the petroleum jelly, so you want to make sure you put the petroleum jelly. You want to make sure you cleanse the penis with warm water at every diaper change. You want to make sure you apply petroleum jelly for the first 3 days for the Gomco and Mogen, and you do not remove any yellow crust over the circumcision site. You don't. And then you don't give a tub bath until the circumcision has been healed. Let's see what else. WBC, your white blood cells, regular white blood cells is 5 to 10, but after you postpartum, after you give birth, it's going to be increased because your body's trying to fight, all the things going on in your body, because WBCs, white blood cells, they fight infection, so it's going to be a little elevated. So it's completely normal, about like 25,000. So it's normal. You want to make sure that you ambulate, so you prevent those DBTs. You want to make sure you're drinking fluids, you're ambulating, putting your compression socks. So when the mother has to when she's going to go in and introduce the baby to the family, to the kids, you want to make sure you take a gift with them, or at least have the babies incorporated in the process so that they don't feel any jealousy, or they're not like thinking about harming the baby. So you want to incorporate them together. Always assess for parental bonding for any what do you call it? You want to make sure that the mother, how the mother is looking at the baby, how they're expressing about the baby. You want to make sure, you know, if they have any questions, you let them know. You try to answer the questions. You want to make sure, what else says ATI mentioned about this? You want to assess if the mother has any signs of like trying to harm the baby because of the hormonal changes that are going on in the woman's body. It can cause them to have just thinking of harming the baby. Forgot the correct terminology, but they can harm the baby, and you want to assess, you know, your mom to see if she's, you know, doing anything to the baby. Mongolian. Okay, so now skin variations, normal skin variations on the baby. So like I said, the nevi, telangitic nevi, which is a pink discoloration, dilated capillaries under the eyelids, between the neck, and that's normal. Milia is normal, the way I think about it. Milia, just a little sweet little girl. Milia, small white cysts, it's normal. Mongolian spots, I think about like the Mongolians, like I don't even know what Mongolians are, but I feel like Mongolians are like, you know, those people, like, have you ever seen like 2012 and like there's that one man, he has the like a something like this, like a little circular bell, I think, and then he like grabs a little stick and things on that because like the tsunami is coming. I don't know, that's what I think of Mongolian, but I just think that's normal. It's basically it's a purple, like a blue purple pigmented skin on the back, on the buttocks, especially in the buttocks. Make sure you know that, because I think I've seen a picture on ATI. The port Weinstein, the nevus flemmis, that's normal, and the erythematoxium, that's normal. That's basically a rash. So ice packs on the perineum to reduce pain. You can do sitz bath, it's important to know. Increased fiber fluids for constipation. You have to know on ATI the primitive reflexes. So the Babinski reflex, very important to know. You have to know that. It's up to 12 months. So the Babinski, where you go like this on a toe. I don't have a toe, but like your toe, go from here, right there. You're not supposed to curl back. Babinski, up to 12 months. The plantar grasp is where they curl their toes. Plantar means like plant, bottom. The infant flexes toes, you know, when it's touched at the base. Tonic neck, you have to know it's kind of like the fencing position. So on page, page 864. Moral sterile reflex. Moral sterile reflex. You have to know. You have to this does show up on ATI either as a picture or just a description. You have to know the moral reflex. You have to know that it's by holding the infant in a supine position, and then you have what do you call it? It's like a sudden jarring or changes in equilibrium causes extension and abduction extremities, you know, with the index finger forming a C. You have to know that it's like a they elicit, you know, this C. Let me see how it's stated on ATI. So make sure you know that. Tonic neck reflex, when the head is quickly turned to one side and the leg stands on that side. So it's like a fencing type of reflex. Like, please make sure you look at the pictures here. You have to know this. This does show up on ATI. Either they'll describe it like as, what do you do? You know, how do you do the Babinski reflex, plantar, the grass reflex, you know, the plantar reflex. I haven't seen the pull sit reflex, but the dancing reflex I have seen. Tonic and moral one. Tonic neck reflex, I have seen that one. So you want to make sure you know your reflexes. So like the moral, the baby extends the arms that bends and pulls them into the body with a brief cry in response to a sensation of falling or a loud noise or a sudden movement. So they do a loud noise or a sensation of falling. That's the moral reflex. Walking, they put it, you know, walk, you know, on the surface. So the sucking reflex, you know, when they begin to suck, when their lips are being touched. You want to make sure you know breastfeeding. When you're breastfeeding, you want to make sure that when you remove the baby from the breast, you insert a finger on the baby's mouth to break the suction. So, I mean, I can't show you guys because like I don't have a kid and like, yeah, but just make sure you like, I don't have a boob or something, but like, let's pretend this is a boob. And so you just insert a finger and break them out. Yeah. So that does show up on ATI somehow, like it's worded some way, something like that. But you want to know you don't microwave breast milk and you don't refreeze the milk for breast milk storage. And you can store the breast milk to 4 hours and refrigerate up to 4 days. The umbilical cord has the AVA, 2 arteries, 1 vein. You do want to assess for the hips for the baby. You want to assess for any dysplasia like Borlo or Otongani maneuvers, because sometimes the legs can be uneven. So the Borlo or Otongani, or any creases, thigh creases. You want to know that they don't open their mouths until they're 3 weeks of birth. Oh, this this heel illustration, you have to know this. This will show up on ATI. And you want to make sure that the first thing you do when you perform a heel stick procedure is to warm the newborn's heel to increase circulation. So the first thing you got to do is warm it up. So make sure pretend you're grabbing the feet and you're like warming it up. And now you get the alcohol swab. So this is the alcohol swab, right? You already warmed it up. So now you got the alcohol swab and you cleanse the area, right? So it can be lateral right here. In here, these 2 areas, lateral, lower lateral, and you just want to clean it, allow it to air dry, and then you grab your lancet and puncture that, and then you put a gauze and you allow that to dry. So I don't have gauze, so I'm just going to pretend to be a band-aid, and you put a little band-aid up there. So that's my little demonstration of how I perform a heel stick. So yes, make sure you know how to perform a heel stick, the process of it. First, you warm it up, right? You warm it up, get the alcohol swab, clean it, let it dry, lance it. Yeah. So make sure you know how to do that. So, but that one does show up on ATI. Always cluster care when you're doing nursing care for preterm. Always cluster care. You want to minimize stimulations. You want to make sure that the infant is having enough oxygen. Surfactant as order. Let's say if they're preterm and they didn't get enough, they don't have enough surfactant. You can give them surfactants. So medication for you guys to know. Hyperbilirubinemia. So if the level is above 5, or just in general, if they have high bilirubin. which increases the chances of having jaundice because high bilirubin is, if you have high bilirubin, your body's gonna have, the bilirubin is basically like the red blood cells, dead red blood cells. And those dead red blood cells make your skin jaundice. I believe that's how it was stated somewhere. Just know, I don't want to confuse you guys. If you have hyperbilirubemia, phototherapy. You want to make sure you do phototherapy, but you have to know phototherapy and how during phototherapy, you want to make sure you don't put any lotion on the baby, right? No lotion. You can turn them every 2 hours. You want to make sure that they have a diaper. You want to make sure that they have the little glasses for their eyes, to cover their eyes. And that's all I remember for that for right now. But you no, don't put any lotion on the baby, and don't cover them up. Normal weight, you have to know normal weight, 5 to 8 pounds. Vital signs, temperature 97 to 99. The way I think about it is, in class, to get an A, safe A, you want to make sure you have a 97 to 99% in the class. Pulse 110/60, respiration 30/60, and we already talked about blood pressure, so 60/80, systolic, diastolic 40/50. Hard to see. Make sure that the clips are at the nipple or armpit level and they're in a rear facing car seat. Or they have like that 5-point harness using, make sure that's that at a 45-degree angle. Assess for any signs of hypoglycemia, especially for sometimes mothers. They have diabetes mellitus, and the baby might be sometimes like, hold on, let me see how I'm going to state this because I don't want to get you guys confused. But I can see it in my head. I can see how everything happens, but I just can't figure out the words and how to say it. Just make sure that, okay, so I believe it's like this. So if the mom has diabetes mellitus and she has high blood pressure, the baby, is used to having that the sugar being high, I believe, everything being high. So like when the baby is born, their blood sugar decreases. And now that risk for hypoglycemia, and signs and symptoms of hypoglycemia is that shakiness, the diaphoresis, the jitteriness, the weak cry. So you want to make sure that you perform the heel stick. That's what the heel stick's for, to assess for the blood levels with the heel stick. Infant quieting techniques, page 871. You want to make sure that you pre-warm the crib sheets. That'll show up on ATI, helps them be quiet down. You can have them in a stroller. That also helps. And you want to make sure that on page 870 how an infant stool versus a an infant stool, how the infant stool of somebody that's being breastfed versus somebody that's formula fed, how they differ. So this here, I'll show you guys right now. As you see, the breastfed, this guy is being breastfed. This guy is being formula fed. This is more like thick, more brownish, and this is more like thin, just tan yellowish, but like not as dark as the other one. So breastfed infants are still like yellow to golden, like very pasty, and they have an odor that's similar to sour milk. The formula fed kids, they're gonna have yellow to light brown, and it's more firm. So you want to make sure you know that. Firm for formula and pasty for breastfed infants. Okay. Now I'm on chapter 29. I'm sorry I'm going so fast, but I'm just trying to let you guys know what I've seen on ATI. Okay. So care of high-risk mothers. So that's what I'm going to start off with, and then that would be it for this. But you have to know this because this does show up on ATI. Oh, I forget. Okay. For miscarriages, you want to make sure you know that spontaneous abortions, so aka miscarriage. So you want to make sure threatened is where it's threatened, slight bleeding, but it's like kind of like threatening. I'm like threatening you to like it could happen, it could not happen. Where you have slight bleeding. Inevitable is like it just happens. Like you couldn't, just kind of float out. You want to make sure incomplete is where you still have like parts, remaining in there. And complete is like more complete, bleeding, passage of the fetus in tissue. And missed is where there's no spine, no cervical dilation. So in general, you just want to make sure you do a DNC, a dilation and curtilage, because you want to make sure that everything is just coming out. A DNC is basically where you do like they go in and they get out all the remaining stuff out there. Okay. I want to talk about mastitis now. Mastitis is inflammation of the infection of the breast tissue, and your breast is going to be firm, red, swollen in one breast area. Mastitis inflammation, if you can think about it, ITIS is inflammation, and it's just going to be in one area. What you have to, this does show up on ATI, so you have to know mastitis. So it's inflammation, red, swollen in one breast, and you just basically for treatment, you want to give them antibiotics. You want to make sure that you fully empty the breast, or you manually express it, or you pump it out. You want to make sure that you practice good hand hygiene, and make sure that you basically just wash your hands, take those antibiotics. You are going to be, you could have like present like with fever, malaise, or some chills, but you want to make sure you take those antibiotics, wash your hands, and you make sure you empty those breasts. So mastitis, inflammation, antibiotics, express the milk, make sure you empty it out. Atopic pregnancy does show up on ATI, and you have to know that it's an unilateral stabbing in the lower back. Basically, cause, like we mentioned before earlier, IUDs can, cause this. So you want to make sure you know that they're going to have just pain in the lower back. So it's very important that we get rid of this pregnancy, because it can, have other complications if it's somewhere that it's not supposed to be in, like if it's implanted somewhere else in the abdomen. We want to make sure that we, dissolve the pregnancy, because you want to make sure you save those fallopian tubes. You want to give that one medication that you do give is methotrexate, and you have to know that one. That medication is also given, it's immunosuppressant, but it's also given for patients that have rheumatoid arthritis, but it's also given for patients that they're given for patients that have ectopic pregnancies to dissolve the pregnancy, because you want to save the fallopian tubes above anything else. But with methotrexate, there are contraindications. There are a lot of contraindications, but just know, I want to say for ATI, just know that you give them methotrexate to dissolve the pregnancy. If the patient doesn't qualify to take methotrexate, then they can do a splenostomy or splenectomy. You have to know those words. I don't know how else to remember, but just splenostomy, splenectomy, which is just the removal of the ectopic pregnancy via surgery. So either you can take med or you can do the a surgery to remove the ectopic pregnancy. So you have to make sure you know that hydatiform mole or molar pregnancy, you have to know that it causes prune juice bleeding, vaginal dark brown prune colored bleeding. You don't have any pain, but you have to, this is where basically what happens is you just have an abnormal growth of cells that didn't go through fertilization. So there's no sperm that attached to that egg. So it's just like a replicating kind of I don't know how to explain it, but it's like an embryo that doesn't have a sperm, and it can cause choriocarcinoma. That's very dangerous because you don't want to lose your you basically don't want to have that going on down there, right? Your Hcg levels are going to be high. I don't know if I mentioned this earlier, but when you're pregnant, your Hcg levels are going to be high, but they're a little higher than expected for a molar pregnancy. And it's going to show up as like, oh, it's going to show up as you being pregnant, which, yes, of course, the levels are pregnant, but when it got fertilized, just the way it got fertilized, the sperm just wasn't there to like have all the like the chromosomal and like just make sure signs and symptoms are prune juice and high levels of Hcg above the expected range. You have to do a D and C. So, and you have to be monitored for Hcg afterwards. But what's important to know is that make sure you know that the levels are monitored every 6 months after a D&C. You have to avoid pregnancy for 1 year. Because if those Hcg levels start to increase again, then you could increase your chances for having this cancer. So make sure nope, you don't, after the D&C, you don't get pregnant for 1 year. And you want to take precautions. You want to do the Romagam. You want to take that. That's a thing that you want to take. Ooh. Okay, sexually transmitted infections, chlamydia and gonorrhea. You give them the erythromycin ointment. Remember, when the baby is born, erythromycin ointment, so that they don't get this chlamydia and gonorrhea. That's what you need to know for that. I've seen that on ATI, so make sure you do the ophthalmic ointment. You want to make sure that cervical insufficiency. So patients that have cervical insufficiency, their cervix is incomplete. So if it's incomplete, they're most likely to miscarriage. So what providers can do is they can do a cervical serology. The cervical serology is done around 14 weeks of gestation, where they close the their cervical. They close it like this. And now the baby can't get out, right? They can kind of go all the way through almost to like full term, but around 37, 38 weeks, around there, that's when the provider is going to, you know, either take it out or they can do a C-section. But make sure that you know that a cervical serology is done for patients that have insufficiency incompetence. So it's not fully like circled, tight, closed. So after that procedure is done, obviously, you know, you have this like string that your cervix, you know, is being closed, like with two strings attached, like this. Let's say he does this, right? This is your uterus, and he puts that there. So that way there's no gap right there, right? He closes that. So what happens now is, obviously you're gonna have this right inside your body. So make sure it's inside your body. Oh, okay. And now if you have that there, I mean, you don't want to be lifting heavy objects. You don't want to be having sex. You don't want to be doing high levels of activity. You want to make sure you're bed rest and you're drinking your fluids, right? HIV, make sure it's standard precaution. That does show up on ATI, standard precaution. Make sure you know it's standard precaution. And the mother should not breastfeed, and they should not deliver vaginally. So even a woman. They have to do C-section for that. So no, they can't deliver through the vagina. So make sure they do C-section. Neonatal abstinence syndrome. So this is where the infant, they show signs of high pitch, like shrill cry, like it's very, very, the noise is just so loud, like so like the shrill, it's kind of like makes you think like, okay, like are they okay? Like high pitch, like very high pitch. They can have tremors, convulsions, and this is due to the mom using drugs, especially opioids during pregnancy. So when the baby is born, they have these like tremors, they have convulsions. So you want to give the baby morphine sulfate. You can give them, you want to make sure that they are on seizure precautions. If they're having tremors, high pitched cry, convulsions, seizure precautions, so you want to make sure you decrease stimulation. You want to make sure that you refer mom, you know, to an alcohol treatment. But basically seizure precautions. You want to make sure baby's in seizure precautions, but any baby that has a high pitch cry, that could be indicative of neonatal abstinence syndrome. So, okay, so this is what I was talking about earlier. Gestational diabetes mellitus. If the mother has hypertension, obesity, you know, they can have a, what's it called? A fetal macrosomia, so a big baby. And when the baby is born, they can have neonatal hypoglycemia. So you have to know that you have to monitor for the baby for hypoglycemia and hyperglycemia. Please make sure you guys know signs and symptoms of hyper and hypoglycemia. Cool and clammy, need some candy for hypo, and hyperglycemia, the 3 P's: polydipsia, polyphagia, polyuria, and they're going to be warm and dry. So polyuria, excessive urination, polyphagia. The G looks like your, like a G, like your I don't know. The G just gets me, the hunger. Maybe because hunger, I don't know. Polydipsia, excessive thirst, free breath odor, for sure, for hyperglycemia. Okay, almost done. Okay, so placenta previa, you want to make sure that you know that placenta previa. So this is where the placenta kind of like goes up here. Like, I don't know how to, let me see. Let me draw it out. Placenta previa. So in your uterus, right? This is where your wee-wee is at. The placenta Placenta should be, this is where your legs are at, right? Your legs. This is your wee-wee. And this is a placenta. Placenta should normally be around right here. But if you have placenta previa, it kind of goes up here. It kind of starts going down. There's different types of placenta previa, like that they're stated differently on what, according to what position, where they are within here. Sometimes the placenta previa can go all the way down here, right? And now it's covering this exit path where the baby is going to come out. So you're going to have painless bleeding. It's not like placenta, it's not like the other one, the placenta abrupto, where it detaches. This is the painless bright red bleeding. And you don't want to perform a vaginal exam. Definitely not. You want to make sure you do a C-section for this patient. The abrupto placenta, the one that I was talking about, that one does have severe bleeding, severe abdomen bleeding, severe abdominal pain, because the placenta does become detached if you have hypertension. It's a sign. That's one of the factors that can cause the that to detach. Right, it's like a little band-aid, it attaches. Or if you have like a hard fall, if you fall, right? Oh, it hurts, you know. You're gonna have abdominal pain and dark red bleeding. Dark. So this is an emergency. You're gonna have to do a C-section for this mother. Hyperemesis Gravidarum, like how we talked about earlier. You're gonna have a decrease in your electrolyte imbalances. So you want to monitor for weight loss. Your weight, increase intake and output fluids. You want to make sure you know the hypertensive disorders. So where is it stated on here? I like how it's stated on here. You guys can just skim through the book because they do have more pictures on here. I'm just putting out there what I've seen on ATI from what I remember, but the book does have more pictures on here. Okay, so hypertensive conditions in pregnancy. So okay, so chronic hypertension is just basically present in women before pregnancy that occurs before 20 weeks of gestation. So put that aside. Okay, that's what we are concerned about, is the condition that happens after 20 weeks of gestation, because this can cause eclampsia, and we don't want eclampsia. What you do have to know for ATI, because it does show up, would be that the mild eclampsia and severe eclampsia, both of those, like mild, severe, lead to eclampsia if it's not treated. So mild eclampsia, that one, you have a blood pressure of 140/90, and you have positive 1+ to 2+ albumin readings and a urinary output that's at least 500 millimeters per 24 hours. So, and you have edema, right, in the face and the ankles, and that is indicative of like eclampsia, preeclampsia, mild preeclampsia. Severe preeclampsia is 160 over 110 blood pressure, and your albumin starts going up 3 to 4, and you're now urinary output less than 500 millimeters per 24 hours. You have continuous headaches, blurred vision. So the way I think about this is preeclampsia 1 to 2, severe eclampsia 3 to 4 albumin. As you start going to severe eclampsia, your blood pressure is significantly more higher, so 160, maybe 180, I believe. But you do have those signs and symptoms that I mentioned earlier, where you have the epigastric pain, you have continuous headache, the diplopia, you have the facial edema, you have maybe an upset stomach, or just continuous headache, that is indicative of preeclampsia. And you definitely don't want to get to a point where you're having the eclampsia, because that's where you're going to have, the seizure activities, and you don't want to have that. So make sure you know severe, mild eclampsia and severe eclampsia, the differences between those two, because that does show up on ATI. And I believe magnesium sulfate would help with phase seizures. Make sure you guys know that. Hypertensive disorders, we already talked about that. Magnesium toxicity, right? We have that. It's not one med. I will pull it up right now. That med I need you guys to know. That does show up on ATI. Torch. The one that I've seen on ATI is just don't clean a cat litter box, because it has like contaminants, animal feces there. You want to make sure the rubella 28 days afterwards, don't get pregnant. Hyperbilirubin, you do the phototherapy, protect the eyes. Remember I said they can wear a brief or a diaper, sorry. You don't want to apply any lotion. You can have them, you can have the parent hold the baby in a Villi blanket. That'll show up on ATI. And you want to make sure you turn them frequently. So this is what I need you guys to know. This does show up on ATI. You have to know the difference between a physiological jaundice and a pathological jaundice. So physiological jaundice, it should never occur within the 24 hours, the first 24 hours. But pathological jaundice, it's normal to occur after 24 hours. So, sorry, did I state that right? You should begin sometime. Yeah, so it should never occur. Hold on, let me see if I'm getting this right. Hold on. Yeah. So, pathological jaundice, which occurs within the first 24 hours, is not, you don't want that, right? Because that, you're going to have jaundice, yellow discoloration of skin, eyes, so you don't want it. Pathological, I think of it as a pathological disease. I don't know if it's, I just think of like a pathological disease. It's really bad. You don't want it within 24 hours. And physiological, I just think of like physiological, the physical appearance. It's normal to have it after 24 hours. After 24 hours, yeah. But you definitely don't want to have it a pathological jaundice within 24 hours. It's bad. No, you don't want it pathological. So make sure you guys know that. DVTs, ambulate, apply anti-embolic stockings. Make sure you put the anti-embolic stockings before getting out of bed. That does show up on 18, before getting out of bed. And you never cross your legs. Drink lots of water and no smoking. Never massage your leg, if you're suspected of having a DVT. What you use to assess for DVTs would be a Doppler. Doppler to assess for DVTs. Signs and symptoms of a DVT would be your 5 cardinal signs. So your warmth, so erythema, edema, pain, swelling, redness, unilateral leg pain. You want to make sure that that, let's see what else. UTIs, more prevalent in pregnant women because of the shorter urethra. So make sure you're urinating frequently. You want to make sure wiping from front to back, no douche baths, cotton, underwear, urinate after having sex. And you report any cloudy and foul smell or any dysuria or urinary frequency if you're having that, a lot. So you want to make sure you report that. And suprapubic pain. So make sure you take a shower instead of a bathtub. Iron deficiency anemia, You guys already know that, but just make sure green leafy vegetables, liver, chicken, and fish. High amounts of iron in there. Candida, make sure you know that at least like you know what it is. That it's a thick white vaginal discharge. And we always avoid tight clothing. Just cotton underwear you want to put. Oh, this does show up on ATI. The group B streptococcus B, group B streptococcus beta hemolytic. I don't even know if I said that right. But the group B streptococcus beta hemolytic does show up on ATI, and basically it's just a bacterial infection that can be passed down to a child during the birthing process. And you want to make sure you take antibiotics. That's it. You need to know it's for antibiotics. Pulmonary embolism, chest pain, difficulty breathing, tachypnea, chest pain, dyspnea, hypotension. Make sure you know what it is. That's it for that. That's it. If you guys can maybe just go through the book, skim through the ATI book. I mean, for maternity, I remember I used the Bible a little more than I did the ATI, but I know this test is ATI, but if you guys can maybe just skim through it. But the ones that I mentioned that I talked about today, or yeah, in this video, those did show up on ATI from what I remember. So yeah, so that's it for maternity. Oh, what else? I remember from maternity. I believe that's it that I know of for right now. I don't think I have anything else. I can't remember right now. Oh, let's look through this really quick. I want to show you guys. Here, where is it? Mother baby 57. Hopefully it helps, you know. Where is it? Up here. Mother baby. So I would say go with ATI on this for the trimesters, because I know this is second trimester, 27 weeks. So go with ATI. I'm not gonna go over the GPAL because I don't want to confuse you guys for that one. You have to know presumptive, probable, the ones that we talked about. You have to know this. You have to know how you get increase everything, increase blood pressure, except blood pressure stays the same. Yes, that's true. Blood pressure does stay the same. Let me see if I can go through it really quick. Enlarged breast, presumptives for breast, amenorrhea. Those are important to know. You get that quickening, urinary frequency, that nausea, vomiting, right? Emesis, nausea, vomiting, that show up on ATI. You want to know the Braxton Hicks contraction, the Chadwicks, the Hegars, elevated Hcg, the Bottlemans, that one to show up, and the positive. Oh, right here. Chadwicks. This is how I like it, how it's like stated right here. Chadwicks, a bluish color of the volvula or cervix. Hagar sign, lower uterine segment, and the Goodwill sign, a softening. So, softening cervix. So please make sure you know definitions for Chadwick's, Hagar's, and Goodwills. But on ATI, it just states it as, we are seeing it just as the signs. But the definitions would be very, very important to know for NCLEX. Positive signs, you know, like devices, you hear the heart tones, you hear it you see it on the ultrasound, visible movement, so that would be positive. Pregnancy tests will also fall under Probably. Pitosis, excessive salivation. No. It's heartburn. I thought that was pyrosis. Increased progesterone, LOC to the left, and heartburn. Let's see. Sure. That does show up on ETI. Pitletism, that's what it is. Pitletism is excessive salivation, and you want to make sure you suck on hard candy or gum. But this is pyrosis, heartburn. Pica, you know that one, because of a decrease of iron or zinc, constipation, fluids and fiber. This is normal, so you want to make sure this is normal. These I've seen. Oops. Whoa. Let's see, what else have I seen? Lordosis, carpal tunnel syndrome sometimes. Nigel's rule, -3+7. You have to know this. -3+7. You have to know the rubella vaccine. No, they should avoid. You do the rubella vaccine too. 28 days. This I would do ATI, because ATI, I believe, you know, it does kind of like, ATI is better for this one, for the stages of delivery. I would focus on that. You need to know this. You have to know firm and midline is very important to have that in the recovery stage. The placenta, assess of fundus. You have to assess for any infection, assess for any lacerations, you know, in the buttocks, respiration, depression, any hemorrhages. You have to know that if it's soft bogging displays, make sure they urinate, go to the bathroom, and massage it, or you can give oxytocin. You have to know the true, stronger, closer together, reading from lower back to the lower portion of the abdomen. You have to know this. Labor, you get lightning, you get that bloody show, you get that cervical ripening, you get, what else have I seen? It's the weight loss. Veal chop, you have to know this. Veal chop. This is important to know. The heart tones. Let's see. Preeclampsia. Proteinuria, rising blood pressure, and edema. You get that. These are your signs and symptoms. You have to know the headache, severe constant headache, epigastric pain, visual disturbances, decreased urinary output, hyperreflexia, and weight gain. Oh, how do I say that? I'm not sure, but I've seen these before. Also, I think side lying, all the seizure activity, like what you would take for anybody that has any seizures. You know, no section. You want to give this medication for sure, magnesium sulfate, but you also want to make sure that you know that it does decrease respiration. It does decrease. I believe these are the reflexes, and then reflexes. Decrease urinary output for sure. You have to know that. Toxicity, sense and toxicity. You have to know that. Veal chop, I can't stress it enough. Veal chop, you have to know veal chop. At least know what happened, you know. Variability, cord compression. Most of the majority of the time, you're gonna have to do left lying position. Cephalic, breathe. I haven't seen those, but it's good. You have to know it's for NCLEX though. But I'm just pointing out what I've seen from this labor and birth. You have to know it's the scaenial spine right here, the stations. You have to know how it's documented. You have to know this the engagement part, how the fetal station, the baby is engaged. It's going to be at 0 over here. The scaenial spine there. Sorry. So this is important to know too. This is the what females want your pelvis to be like this so the baby can come out. What else? APGAR score, at least know what it does. What you assess respiration, appearance, pulse activity, you have to know. Umbilical cord, the AVA, you have to know it's important. You need, please know this. Respiratory, heart rate, 97 to 99, your grades, you want 97 to 99. Just this is what I was talking about. 60 to 80, 40 to 50. And if just sleeping, they're less than 100. Always assess for 1 minute. Oh, this retractions, nasal flaring, and grunting, respiratory distress. For the head, you have to know this. Septal hematoma and caput cystium. You have to know the head circumference and the chest circumference. And this. You want to make sure you know this. The bladder, it's displaced or not. Postpartum hemorrhage. Here. But what I really want you guys to know, oh, it's not on here. This med. Turn on with thyroxine. What is this, endocrine? What is this? Psychiatric meds. Where is it? Pain management. Nope. Oh, it's not on here. Okay. Hold on. Magnesium sulfate. Magnesium sulfate can cause a decrease in the reflex for toxicity, decrease respiration rate, and decrease urinary output. You have to know that. And because that does show up on ATI. And you have to know your medication for terbutaline. It halts like the labor, delays labor. You have to know that. Terbutaline ends in line. You want to wait in line. So oxytocin is important to know. This is stimulates urinary contractions. Misoprostol, you want to know. It's a cervical ripening agent. So the cervix softens, so the dilation and placement can occur more easily during contraction. But it is contraindicated if you have a history of abnormal fetal heart rate or receiving medications that stimulate contractions like oxytocin. You never administer oxytocin and misoprostol together. So that's what you got in for that, from what I remember. That's it. I believe that's the opportunity. I know it's a lot. I'm sorry I went too fast. If you guys can, it's very important to go over the ATAD book or the Bible, whichever you guys feel comfortable with, and go through it. And you guys can do practice A and practice B from maternity. But that's it. That's all I have for this.